Welcome to Beyond the Job Title, Why Healthcare Needs Everyday Project Managers, an audio podcast brought to you by Academicare. I'm Rebecca Samati, Commercial Lead at Academicare, and today we're exploring a topic that's often overlooked but absolutely vital: the everyday project manager in healthcare. This audio podcast is for the practice managers, clinicians, educators, digital leads, and operational staff who find themselves leading change, solving problems, and coordinating teams, without ever being called project managers, because in healthcare the title doesn't matter, the work does. And over the next 40 to 50 minutes, we're going to explore why this matters more now than ever before. What happens when we don't recognise this critical work? And most importantly, how can we support and empower the people who are already doing it? And I want to start by discussing the invisible project manager, and I will start with a story. Meet Sarah, a practice manager in a busy urban surgery. She was asked to implement a new digital triage system. No project team, no timeline, no budget, just a vague directive: make it work. And she did. She coordinated with IT, trained staff, redesigned workflows, and managed patient communication. She handled resistance, solved problems, and kept the whole thing afloat while still managing her regular responsibilities. But let's pause here and really think about what Sarah actually did. Because when I say coordinated with IT, what that really means was she scheduled multiple meetings across different teams without conflicting priorities. She translated clinical needs into technical requirements. She negotiated timelines when the IT team was already stretched thin. And she became the bridge between two worlds who often struggle to understand each other. When I say she trained staff, that meant she identified different learning styles among her team. She created training materials that didn't exist. She ran sessions before work, during lunch breaks, and after hours to accommodate different shift patterns. She handled the anxiety of colleagues who felt overwhelmed by new technology, and she celebrated small wins and patiently repeated explanations for those who needed more time. When I say she redesigned workflows, that involved mapping out existing processes that had never been formally documented, identifying bottlenecks and inefficiencies, consulted with everyone from reception staff to senior clinicians, tested new approaches, iterated when things didn't work well, and all of this while ensuring patient care never suffered. Sarah wasn't called a project manager, but she was one, and she's not alone. Across healthcare, people like Sarah are leading complex change every day. In community pharmacies, managers are implementing new services while managing prescriptions and patient inquiries. In hospitals, ward sisters are coordinating discharge pathways involving multiple departments and external agencies. In mental health services, team leaders are redesigning referral processes to reduce waiting times. In care homes, managers are implementing new care planning systems while maintaining standards and morale. They're not working from Gantt charts or formal methodologies. They're working from instinct, experience, and a deep commitment to patient care. But here's what's remarkable. They're often using sophisticated project management techniques without even realising it. They're identifying stakeholders, managing risks, communicating across boundaries, and monitoring progress. They've just never had the language or framework to recognise what they're doing as project management. And this creates a problem. When you don't recognise the work you're doing, you can't systematically improve it. You can't ask for the resources you need. You can't mentor others in developing these skills, and you certainly can't protect yourself from burnout when you're carrying an invisible workload that nobody else can see. And what happens without them? Let's imagine a healthcare system without these everyday project managers. Projects stall, innovations fail, staff burn out, patient care suffers. But let me paint a more detailed picture of what this actually looks like in practice. Without someone quietly coordinating the moving parts, even the best ideas collapse under their own weight. A new digital system might be purchased, often at a significant cost, but never properly embedded. It sits there, technically functional, but nobody really uses it because the workflows weren't adapted, the staff weren't properly trained, or the system doesn't actually solve the problem people face in their daily work. A trust might spend hundreds of thousands of pounds on an electronic patient record system. The implementation is led by IT specialists who understand technology but not clinical workflows. 6 months later, staff are still using workarounds and paper notes because the system doesn't fit how they actually work. That's not a technology failure, that's a project management failure. Specifically, it's the absence of someone who understands both the clinical context and how to manage complex change. Or consider a service redesign that might be drafted but never delivered. A consultant creates a beautiful vision for integrated care. The PowerPoint presentation is compelling and the board approves the plan. But then what? Who breaks that vision down into actionable and achievable milestones? Who identifies the dependencies? Who ensures that the community teams and the hospital teams and the social care teams are all working towards the same goals? Who tracks the progress and adjusts when things inevitably go off course? Without an everyday project manager, someone embedded in the reality of how care is delivered, that redesign remains a document, not a reality. A policy change might be announced but never understood. Think about how many times healthcare professionals receive new guidance or policy updates. These arrive as an email, as an announcement in a team meeting, as an update in a newsletter. But who ensures that people actually understand what's changing and why? Who helps teams translate policy into practice? Who identifies the implications for different roles? Who supports people through the confusion and resistance that naturally accompanies change? The result of all of this? Wasted resource. Not just money, but time, energy, and goodwill. Frustrated teams who've been through yet another initiative that didn't deliver what was promised. Missed opportunities to genuinely improve how care is delivered, and ultimately poorer outcomes for patients who experience fragmented, inefficient, or delayed care because the system can't effectively implement the changes it needs. There's also a human cost that we rarely talk about. When projects fail because they lack proper management, it's not the senior leaders who feel the consequences most accurately. It's the frontline staff who are left dealing with half-implemented systems, conflicting instructions, and the gap between what was promised and what was delivered. This breeds cynicism. It makes people resistant to future change because they've learnt that change often means more work, more confusion, and rarely the benefits that were promised. So why is this conversation urgent now? Well, because healthcare is changing and it is changing fast. The NHS Fit for the Future 10-year health plan for England sets out 3 major shifts. From hospital to community, meaning that there will be more care available on people's doorsteps and within their homes. From analogue to digital, meaning that new technology will free staff from administrative tasks and allow people to manage just easily as when they use their online banking as an example. And lastly, from sickness to prevention, reaching patients much earlier rather than when they are already sick. These shifts require transformation at every level, not just in policy but in practice. And that means more people, especially those on the ground, are being asked to lead change. But let's unpack why each of these shifts specifically demands strong everyday project management. The shift from hospital to community means we're fundamentally redesigning where and how care is delivered. Services that were once centralised in large institutions are being distributed across neighbourhoods. This requires coordinating multiple organisations with different cultures, different IT systems, different priorities, and different funding streams. You need people who can navigate these complexities, build relationships across organisational boundaries, and keep everyone focused on the shared goals of better patient care. Think about setting up a neighbourhood health hub. You're bringing together GPs, community nurses, physiotherapists, mental health practitioners, social care workers, and the voluntary sector partners. Each bring their own professional perspective, their own constraints, their own ways of working. Making this function as an integrated service rather than just a collection of separate teams requires sophisticated project management. It requires someone who can facilitate difficult conversations, negotiate shared protocols, and create systems that work for everyone. The shift from analogue to digital is perhaps the most visible transformation, but it's also one of the most challenging. We're not just swapping paper for screens, we're changing how information flows, how decisions are made, how teams communicate, and how patients interact with services. Every digital implementation is actually a change management challenge wrapped in a technology project. And here's the thing, technology projects fail more often because of poor change management than because of poor technology. The software works, the servers are reliable, but nobody thought about how the new system would affect the receptionist's workflow or how the district nurse would access patient records in someone's home, or how the elderly patient would book an online appointment. Digital transformation needs everyday project managers who understand the human side of change, who can spot where technology might create new problems even as it solves old ones, who can prepare teams for new ways of working and support them through the inevitable challenges. The shift from treating sickness to prevention, it requires perhaps the most fundamental change in mindset and practice. Prevention isn't dramatic. It doesn't have the immediate visible impact of treating an acute illness. It requires long-term thinking, sustained effort, and coordination across multiple services and sectors. You're working with schools, employers, housing providers, leisure services far beyond traditional health boundaries. Implementing prevention programs requires project management skills that healthcare hasn't always prioritised. Population health management, early intervention programs, health coaching services, these all need clear goals, measurable outcomes, coordinated delivery, and persistent follow-through. They need everyday project managers who can maintain momentum over months and years, not just weeks. Historically, project management in healthcare was seen as a specialist function, something done by people with formal training, often in corporate or IT settings. There were project management offices in large organisations, usually focused on major capital projects or large-scale IT implementations. These were important, but they were disconnected from the daily reality of delivering care. But today, the reality is different. Change is happening everywhere, and it's being led by people who never asked to be project managers, but became them out of necessity. The practice manager implementing a new appointment system, the clinical lead redesigning the referral pathway, the ward manager coordinating discharge planning, the education lead developing a new training programme. The NHS Fit for the Future 10-year health plan recognises this. It calls for a more flexible, skilled and empowered workforce, one that can adapt, innovate and lead. It acknowledges that we need to invest in developing our people, not just recruiting more of them. It's a once in a generation opportunity to rethink how we support and develop our people, and crucially, to recognise the leadership that already exists throughout our healthcare system. That is why the conversation is urgent now. Asking more people to lead more complex change, but we're not always giving them the recognition, the tools, or the support they need to do it well. You might be thinking here, what are the risks of ignoring this? Let's be clear, poor project management in healthcare isn't just inconvenient, it's dangerous. According to PwC's analysis of NHS risk profiles, patient care is the top risk across the sector. That's not surprising when projects are poorly scoped, under-resourced, or miscommunicated. The consequences ripple through the system. Delayed treatments, misaligned services, staff burnout, and reputational damage. But I want to get specific about what these risks look like in practice, because abstract risk categories don't capture the real human impact. Poorly scoped projects mean implementing a new prescribing system without properly understanding how prescriptions currently flow through the organisation. The result? Delays in patients receiving medication. Pharmacists and doctors spending hours troubleshooting instead of seeing patients. Potential medication errors because people are working under pressure with an unfamiliar system. Under-resourced projects might look like asking staff to implement a major service change while maintaining their full existing workload. The result? People working unpaid overtime, corners being cut, burnout. Good people leaving the service, and ultimately the project either failing or being implemented poorly with ongoing problems that undermine its benefits. Miscommunicated projects might involve rolling out a new referral pathway without ensuring everyone understands their role. GPs think that they're referring to one service, but the hospital is triaging to a different service. Patients fall through the gap. Wait times increase. Frustration grows on all sides. And in a system already under pressure, those risks are magnified. The NHS is facing record waiting lists, workforce shortages, and rising demand. There's no slack in the system. Every inefficiency matters. Every failed project has real consequences. Consider the compounding effect. A poorly managed project wastes 6 months and achieves nothing. That's 6 months when the problem the project was meant to solve has gotten worse. That's 6 months when staff have become more cynical about change. That's 6 months when the resource invested could have been used elsewhere. And when you eventually try again, you're starting from a worse position than when you began. There's also a less visible but equally serious risk: the opportunity cost. Every moment that talented healthcare professionals spend firefighting the consequences of poor project management is time they're not spending on patient care, on innovation, on their own professional development, or frankly, on maintaining their own well-being. Imagine a practice manager who spends hours every week dealing with problems that stem from poorly implemented systems. Hours that could have been spent improving services, supporting their teams, or engaging with patients. That's not just inefficient, it's unsustainable. And let's talk about the reputational damage. When patients experience delays, confusion, or fragmented care because of poorly managed service changes, it erodes trust. Trust that takes years to build and moments to destroy. In an era where patients have more choice and higher expectations, healthcare organisations cannot afford to damage their reputation through poor project delivery. But there are opportunities ahead. The good news is everyday project managers are already making a difference. They're redesigning services, implementing new technologies, improving patient pathways, and leading quality improvement initiatives. And they're doing it with limited support, often learning on the job. Let me share some examples that illustrate the impact these everyday project managers are having. Let's imagine a group practice in an urban city. A practice manager leads a project to implement a comprehensive diabetes management program. They coordinate with local pharmacists, dietitians, and podiatrists to create and integrate care pathways. They work with a clinical team to identify patients who would benefit most. They develop patient education resources, set up regular review systems, and 12 months later, the practice has significantly improved their diabetes outcomes. They have reduced emergency admissions and received glowing patient feedback. That's everyday project management creating real impact. A further example might be seen in a community mental health team, where senior practitioners redesign the referral and triage process. The previous system had a 12-week wait just to be assessed. They mapped the existing process, identified bottlenecks, and consulted with the team, and designed a new approach that provided initial support within days and triaged people more appropriately. They managed resistance from colleagues who were comfortable with the old system and created new templates and protocols. They also trained the team, and 6 months later, wait times had dropped dramatically, and more importantly, people in crisis were getting help quickly. That's everyday project management saving lives. But imagine what they could do with the right tools, training, and recognition. The NHS transformation agenda is full of opportunity. From neighbourhood health centres to digital first care, from integrated services to personalised care plans, these initiatives need people who can lead change on the ground. Neighbourhood health centres need project managers who can bring together diverse professionals and create genuine collaboration, not just co-location. Digital first care needs project managers who understand both technology and the human side of healthcare, who can ensure digital solutions enhance rather than complicate care delivery. Integrated services need project managers who can navigate complex organisational boundaries, build trust across sectors, and keep everyone focused on shared goals. Personalised care needs project managers who can implement new approaches while ensuring equity, who can manage the complexity of tailoring services without losing efficiency. That's where everyday project managers come in. They're not abstract strategic thinkers removed from reality. They're embedded in services. They understand the context. They have relationships with the people who need to change. They have credibility because they're one of the team, not an external consultant parachuted in. This is actually healthcare's competitive advantage if we choose to recognise and develop it. We have thousands of talented, committed people who are already leading change. We just need to give them the frameworks, the confidence, and the recognition to do it even better. But what about the emotional labour of leading change? When you're managing change, you're not just dealing with tasks, you're dealing with people, their fears, their resistance, their exhaustion. You're holding space for uncertainty while trying to move things forwards. You're the person others look to for clarity when things feel chaotic, for reassurance when morale dips, and for direction when the path forward is unclear. This emotional labour is invisible but essential. It's what transforms a good project manager into a trusted leader. Let me describe what this actually feels like, because I think it's important to name this experience that so many everyday project managers recognise but rarely discuss. You arrive at work knowing you need to move a project forward, but you're immediately pulled into managing how people are feeling about it. Your colleague is anxious about learning a new system because they struggled with the last technology change. Another team member is resistant because they've seen 3 improvement initiatives fail in the past 2 years. Someone else is overwhelmed because they're already working beyond capacity and can't imagine taking on anything new. You find yourself constantly calibrating, pushing forward when momentum is needed, pausing to address concerns when resistance is building, celebrating small wins to maintain morale, and acknowledging difficulties without letting them derail progress. You become a translator of change. The senior team announces a new initiative in strategic language that doesn't connect with frontline reality. You translate it into practical terms that make sense to your colleagues. You help them see how it relates to their daily work, to patient care, and to their own professional satisfaction. You will manage the emotional dynamics of the team. When two colleagues disagree about how the change should be implemented, you're mediating. When someone feels left behind as someone embraces the change, you're supporting. When success starts to emerge, you're ensuring credit is shared so everyone feels invested in the outcome. You carry the stress of being in the middle. You're accountable to senior leaders for delivering the project, but you're also accountable to your team for protecting them from unreasonable demands. You're trying to honour both commitments simultaneously, and it's exhausting. And here's what makes it particularly challenging in healthcare: the stakes are always high. This isn't about implementing a new sales process or updating marketing materials. Every change affects patient care. Every inefficiency has consequences. Every mistake matters. That weight sits with you, even when you leave work. And it's not limited to those with project management in their title. In healthcare, leadership happens everywhere, in quiet moments of problem solving, in the courage to challenge the status quo, and in the empathy shown during difficult transitions. It's the nurse who takes time to explain to a confused colleague how the new handover process actually improves patient safety. It's the practice manager who notices that one team member is struggling with change and creates space for a one-to-one conversation. It's the pharmacist who shares their own mistakes during implementation to make it safe for others to admit when they're uncertain. This emotional labour needs to be recognised, valued, and supported. Because when it's not, people burn out, they become cynical, they stop volunteering to lead change because the personal cost is so high. Supporting everyday project managers means acknowledging this emotional dimension. It means creating peer support networks where people can share the challenges of leading change. It means giving people permission to say when the load is too heavy. It means ensuring that leading projects is recognised in workload planning, not treated as something people do on top of their real job. Now, let me introduce you to a framework that can make project management significantly more effective and less overwhelming. SMART goals. One of the reasons project management feels so daunting to people who don't see themselves as project managers is projects often start with vague aspirations rather than clear objectives. Improve patient experience, enhance digital capabilities, streamline referral processes. These sound good, but they don't give you a clear target to work towards. This is where SMART goals becomes transformative. SMART is an acronym and it stands for specific. The goal is clear and well defined, not vague or ambitious. Measurable. You can track progress and know when you've achieved it. Achievable. It's realistic, given your resources, time and constraints. Relevant. It matters to your organisation, your team, and most importantly, to patient care. Time-bound. There's a clear deadline or time frame. Let me show you the difference SMART goals make in practice. A vague goal might sound like implement a new digital triage system, whereas A SMART goal sounds like successfully implement digital triage for 60% of routine appointment requests within 6 months, achieving patient satisfaction scores of at least 4 out of 5, and reducing reception staff time spent on appointment bookings by 30%. Do you hear the difference? The SMART goal tells you exactly what success looks like, how you will measure it, and what you'll actually do, and when you will need to achieve it by. The SMART goal gives you multiple measures of success. It's not just about getting the technology working, it's about ensuring it works for patients and staff. The SMART goal identifies specific actions and gives you a clear target to track progress against. Now, why does this matter so much in healthcare project management? Firstly, SMART goals create clarity. When you're managing a project alongside your regular responsibilities, you don't have time to waste on confusion. SMART goals ensure everyone understands what you're trying to achieve and how you'll know if you succeeded. Secondly, SMART goals enable accountability. When the goal is specific and measurable, it's clear who's responsible for what. You can track progress. You can identify when things are going off course early enough to correct them. Thirdly, SMART goals build confidence. One of the reasons people feel overwhelmed by project management is that the tasks feel impossibly large and vague. Breaking it down into SMART goals makes it manageable. You can see progress, you can celebrate milestones, and you can feel that you're genuinely moving forwards. Fourth, SMART goals facilitate communication. When you're reporting to senior leaders, they want to know if the project is on track. SMART goals gives you clear, evidence-based way to communicate progress. When you're working with your team, they want to know what they're working towards. SMART goals provides that shared understanding. Fifth, SMART goals protect you from scope creep. This is huge in healthcare projects. Someone's suggesting adding just one element. Another person has a brilliant idea that would make it even better, and before you know it, your focused project has become an unmanageable monster. SMART goals gives you a framework to say, that's a great idea, but it's not part of this project's goals. Let's deliver what we committed to first, and we can consider that for phase 2. Let me give you a practical example of how to develop SMART goals for healthcare projects. Imagine you're a practice manager who's been asked to improve appointment access. That's a common scenario and it's far too vague to be actionable. Start by asking questions. What specifically about appointment access needs improvement? Same-day appointments, overall capacity, waiting times, booking processes? How will we measure improvement? Patient satisfaction, number of appointments offered, time to appointments. What's realistic given our staffing and resource? Why does this matter to our patients and our practice? What time frame are we working with? Through these questions, you might develop a series of SMART goals, such as achieve patient satisfaction scores of at least 4 out of 5 for appointment bookings within 6 months by implementing online booking for routine appointments and providing SMS reminders to reduce DNAs, or reduce telephone wait times for appointment booking from an average of 8 minutes to under 3 minutes within 4 months by implementing a callback system during peak hours and training additional staff in reception duties. Notice how each goal is specific, measurable, achievable, relevant, and time-bound. Notice also how they work together as part of the overall aim of improving appointment access, but each can be tracked and managed separately. SMART goals don't just help you manage the project, they help you manage the emotional labour we discussed earlier. When someone is resistant to change, you can point to the SMART goal and discuss whether they agree with the objective and the measure of success. When morale dips because progress feels slow, you can point to measurable milestones you've achieved. And when senior leaders question whether the project is worthwhile, you have clear evidence of impact. This is why SMART goals are essential for everyday project managers in healthcare. They bring structure without bureaucracy. They provide clarity without rigidity. They enable leadership without requiring a formal title. Now let me shift focus somewhat and look at from awareness to action and how we can do this. First, we need to recognise the leadership that's already happening, quietly, invisibly, every day. Second, we need to support it. Here at Academica, we've created a short practical guide, 10 project management skills every healthcare professional should master. It's designed to help you build confidence in leading projects, even if you don't see yourself as a project manager. Whether you're launching a new system, improving a workflow, or supporting a team through change, these skills are essential. Furthermore, that's why Academica has also created the Healthcare Project Management Fundamentals programme. It's ILM recognised, cohort based, and designed specifically for healthcare professionals who want to lead projects with confidence without stepping away from their day jobs. You'll explore real case studies, build your own project toolkit, and get feedback from experienced facilitators. It's practical, accessible, and rooted in the realities of healthcare. And yes, enrolment is open. But more importantly, this is a chance to invest in yourself and in the future of healthcare. We have shared a link for you to learn more about our guide and course in more detail below this audio. Now, imagine a healthcare system where project management isn't siloed but shared, where every team member feels equipped to lead change, solve problems, and contribute strategically, not just because they were told to, but because they feel confident and capable. That's the vision behind this podcast, a short guide, and our ILM recognised course. It's not about creating more bureaucracy, it's about creating more clarity, more confidence, more collaboration. And it starts with recognising the everyday project managers who are already leading the way. So here's what I'd love you to do. Download the free guide, 10 project management skills every healthcare professional should master. Share it with your team, your practice manager, your colleagues. Reflect on where you already use these skills and where you might need support. And, if you're ready to go deeper, join us in our ILM recognised course. You'll walk away with a toolkit, a community, and the confidence to lead change no matter your title. I hope you've enjoyed today's discussion. And until next time, stay curious, stay grounded, and keep leading with purpose. Thanks so much for listening. Let's keep the conversation going.